guys, and welcome back. This week I'm continuing my talk about the importance of posture and your shoulder health. So last week we were talking about the dreaded tipped shoulder, which is if we're working at the computer, the shoulder tips forward. It's moving my joint anteriorly and compressing the tissues at the back of my neck. Okay? One of the dangers with that is repeated movement, this external rotation over and over, which will tighten up the tissues at the back of the joint and exaggerate that posture further. Okay, this is an issue for something I talked about last week called internal rotation. So if these tissues are tight, it's going to limit my ability to internally rotate my arm. So Eric, you say, how is that going to affect me? It'll affect you sort of trying, for guys, putting on a sport coat, reaching back behind you to get your arm through the sleeve, and for ladies, doing up your bra can be an issue. So, how do we fix it? The first part of this is getting your shoulder joint back into an active position. So the first part we talked about was pinching the shoulder blades together, steering the thumbs backwards. That's number one. Number two, you want to actually mobilize the joint into that position. So the way you can do this is on a countertop. So I'll use my left arm. So locking the elbows, my belly staying tight. So don't drop the hips forward, keep your midline active. You're going to let your shoulders drop back. Okay, you're going to hang out in this position for at least 1 minute. 2 minutes is ideal, but start with 1 and see how you feel. So what I'm using my body weight to push my shoulder from this tipped position into a nice active position. Okay, that's number one. And number two, we're going to use the cross ball to loosen up the tissues at the back side of our rotator cuff. Okay, and so this is going to be sort of back in the shoulder blade. When you're doing this, you don't want the ball to be pressing on the bone. You want it to be pressing on soft tissue, on muscle. So the difference, for example, if you feel the outside of your elbow, you can feel the bony tip there. You don't want to feel the ball pressing directly on bone. It should be on the muscle, the soft stuff above it. So the way this is going to work, you'll lay down on your back, and the ball is going to be going just beneath your shoulder blade. And what you're going to do is roll around until you find a tight sore spot, which should be fairly easy to do. And what you're going to do is keep the shoulders back and just gently drop your arm down and back up. 2, we're going to do this 10 times and try to find 3 different spots. So remember, when you're on the ball, you shouldn't be getting any numbness down your arm or into your face or mouth. If you do, that's bad. Let's try to reposition. So to 10. And then the retest for that is going to be that upright active position, arm down. So I can feel even now there's much less resistance with that internal rotation piece. So it's going to be a lot easier for me to get on my suit coat. And that's internal rotation.